Come on in, you guys. We got another episode of Jimmy Rants in store for you here today. JimmyRants.com is the website, as always. And if you want to engage live on the show, you got to go follow me over on Instagram Live. I'm at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, you can watch it live. You can also see it on the simulcast if you follow me on my Jimmy Moore personal page on Facebook or my Livin' La Vida Low Carb Facebook page. Thank you guys for being here as well today. If you missed the live, it is up for 24 hours on replay. After 24 hours, they do make it disappear on Instagram, but we always, as soon as the show is over, I upload the video directly to my web guy, Hank. Hank grabs that video and he puts it up on JimmyRants.com. So go over there, you can see all the past episodes. We also throw it up on YouTube, so if you type in a keyword Jimmy Rants, you'll find the show that way as well. But on this show, we do all kinds of things. I'm Jimmy Moore. I rant about things. Sometimes I actually do rant. Most of the time, I'm just talking to you and teaching you from my heart and from my knowledge about keto and fasting and cholesterol and all kinds of things. Lately, though, with this COVID-19 thing being pretty much in our consciousness, I've been trying to provide some content that maybe you're not seeing elsewhere. And a lot of the content has been on the outer edges of COVID-19, of how you're handling the stress of it all, tips for how you handle having to be at home now suddenly when you're not used to that, those kinds of things. Today, I actually have something that is directly related to the patients getting this disease. And if you've been following me lately, you know I got an Instagram direct message on Sunday from a medical doctor friend of mine in New York City. I've known him for many years, Dr. Keith Berkowitz. He is a medical doctor in general practice, and he actually worked with Dr. Atkins in his clinic, 25 years ago, was working in his clinic in New York City. Anyway, he contacts me and he says, hey, I think I found this protocol that could help get some patients off the ventilator. I'm like, yeah, tell me about it. So I give him a call and I posted the audio of the call all over everywhere. It's a Jimmy Rants bonus episode if you want to go watch it. But it was fascinating stuff. And he said that he was having trouble getting government leaders, health leaders, doctors on the front lines treating their patients. He's having trouble getting them to pay attention. But now he's starting to see more and more coming on board. That's what I wanted to talk about here today. There is great momentum happening for this alternative therapy that is low cost, readily available, and proven to help patients with COVID-19 get off the ventilator pretty fast. And that's where the whole issue is with this disease. People that are dying because there's a lack of ventilators and or they're not getting adequate treatment with some of the things that he's talking about. Now, Dr. Berkowitz will be on my podcast tomorrow on Real Talk with Jimmy Moore and Dr. Will Cole. So go to llvlc.com or wherever you find podcasts, look up Real Talk. But he's going to come on there and talk about a lot of these things that are natural combined with traditional medicine that are in a symbiotic way, opening up the floodgates of helping patients with COVID-19, the most severe patients, get off the ventilator within 48 hours. It's pretty remarkable. But I have a series of stories here about how this word is getting out finally. And we have one big name I'm going to tell you about. When I heard this name was now promoting something that Dr. Berkowitz was talking about, I went, okay, yeah, this is big. So stay tuned for that. The first thing I have here is 3 U.S. hospitals use IV of vitamin C and other low-cost, readily available drugs to cut the death rate of COVID-19, and they don't have to stay on ventilators forever. So it's basically a recap of what I talked about, that Merrick protocol. So if you missed that the other day, go back to JimmyRants.com or on YouTube, go back a few episodes, and you'll see where I outlined this whole protocol that includes vitamin C, and thiamine, and go look at steroids. It's a whole protocol that's supposed to help patients with sepsis. Then there's melatonin. I'm doing this all off the top of my head, so bear with me, guys. Melatonin and zinc are the supplements, and then there's 2 drugs, that anti-malarial drug, which we'll talk about here in a second, and then one other drug, Z-Pak. which is the antibiotic. So this kind of gobbledygook of a protocol actually is helping patients recover very quickly from COVID-19. So let's see. In here, we're seeing this being used in Texas and Virginia. Chinese doctors, you guys, are actually the first ones that got on the vitamin C bandwagon. They were the ones that were administering it intravenously. When they tested positive for COVID-19, they would put 2 inexpensive drugs, that anti-malarial drug we talked about, hydroxychloroquine, and then Zithromax, the Z-Pak, into their IV, and they gave them oral doses of melatonin and zinc. So the combination worked, given that their reported mortality rates are much lower than they were anywhere else in the world. So see, China was the first one really majorly hit by this. They caught on to this quick. And here in America, we've kind of been lagging behind, leaving these patients kind of flailing to the point that why? Like, there's no harm in trying this protocol. Even if it doesn't work, there's no harm. So it's kind of silly they're not trying it. But China did. The combination likely worked given that their reported mortality rates are lower. The link to the Shanghai Expert Consensus on Comprehensive Care for COVID-19's patients, it's there. The Chinese tried to do a clinical trial of IV vitamin C, but investigators in Shanghai told them that it was very difficult to get patients to enter the trial. But of the 50 patients who did go in the trial, not a single one of them died. And all of them had severe COVID-19 symptoms. So the question becomes, why aren't U.S. hospitals looking at this protocol more closely? And I've got a few more stories here where we're going to see there is a strong push now to get hospitals that are treating patients to take a closer look at this. This is real, you guys. Like, we're seeing it's low cost, it's effective, it's readily available. Why would you not do this? So why aren't we doing it? One of the doctors who is using this with patients, the only reason I can give is that there is widespread, often well-founded bias amongst physicians against vitamin C. We have to admit that. Like, isn't it crazy that all these biases of people's personal beliefs about things like vitamin C, they get in the way in a crisis situation? I think crisis changes the game, changes the rules, changes how we view things, to the point that we should just lay aside your personal concerns if it's something that's actually working for patients. The persistence of this bias is inexplicable given that the evidence is in plain sight. That's right, we're seeing people reverse this COVID-19, getting off the ventilator and recovering. The worst of the worst cases. And the problem is, once people get on this ventilator, it's about a 50-50 proposition that they're going to die or survive. So why don't we increase those odds by doing something that's relatively easy, it's totally harmless as far as we know. There's no side effects to doing this. Just do it. What would be the harm? And to me, if you're a good medical professional trying to treat patients on the front lines, you need to be giving your patients the very best care that you can give them. And as of right now, this seems to be one of the most effective things. We're 18 months away from having some kind of a vaccination against this. And 18 months is going to be a whole lot of people gone. So why don't we try this now? There's certainly no harm in that. One hospital chain disallowed using steroids in the treatment of COVID-19. Remember, that's one of the parts of the Merrick protocol was steroids. That's because doctors are taught steroids increase the growth of viruses and that steroids would harm patients with influenza. But they all agree that for this reason, steroids should not be given to a patient with influenza or the coronavirus. But they say evidence does not show any harm of steroids in previous epidemics like SARS and MERS, especially when it's late in the disease and the person is already on a ventilator. When the diagnosis of COVID-19, and especially when the inflammatory response begins to deteriorate in breathing or the need for a ventilator, that is the point where these steroids become crucial in helping them heal. The steroids are in the formula to fight the life-threatening inflammation, and all the formula's ingredients are needed together to get the life-saving results. So if you missed it late, I did do a whole Jimmy Rants the other day about this Merrick protocol. So it's Dr. Paul E. Merrick. He's out of Eastern Virginia Medical School in Norfolk. And he put together this whole protocol that uses a treatment for this condition called sepsis. Once you're in sepsis, it's a death sentence. And so they created kind of a sepsis protocol to help patients with that. And it includes a variety of things that we talked about in that Jimmy Rants the other day. But they're doing this hydroxychloroquine, the anti-malarial drug, the Zithromax, which is an antibiotic, and then giving them melatonin and zinc, along with the hydrocortisone, ascorbic acid, and thiamine. And it helps improve the breathing within 6 hours, and within 48 hours, they're off of the ventilator. So this is the big treatment, you guys, that is starting to build some momentum. So Dr. Berkowitz, in this story I'm reading from, in this time of crisis when ventilators are in limited supply, hospitals are overwhelmed with patients and medical staff lack adequate protective gear. They're all putting their lives on the line. Every hospital needs to try this. It is safe, low cost, and highly effective that leading specialists know will save lives in acute respiratory distress syndrome. This is not the time to wait for a vaccine or years for more studies and test results to come out. The important thing now is to keep patients off the ventilators and to save their lives, period. So that's this story. And there's lots of great movement happening in this. And let me tell you, one of the biggest names in health, think about all the people in the world of health and think celebrity. Think of the biggest celebrity name when it comes to health. You may not have a lot of respect for this person, but they are a big name. You have to admit it. Have you heard of this guy named, Dr. Oz? That's right. Dr. Oz is now putting his name into this particular debate. This is from Fox News, by the way. Dr. Oz calls on Governor Cuomo, that's the governor of New York, to lift restrictions on a potential coronavirus treatment. So he called on New York Governor Andrew Cuomo on Tuesday to reverse his executive order that would prohibit doctors from using 2 anti-malarial drugs that are touted as a potential coronavirus treatment. It's outside of state-approved clinical trials or any FDA-approved uses. So Dr. Oz appeared on Sean Hannity's show. He said, I suspect there were concerns for the folks with rheumatoid arthritis and lupus who are dependent on chloroquine and could not get it. It limits the prescriptions of chloroquine and hydroxychloroquine to a 14-day supply with no refills. So Governor Cuomo, Dr. Oz, continues, passed that law to prevent people from taking it and then putting it in their cupboards just in case. So in other words, they didn't want people to stockpile this drug before they even have COVID-19 so that then the people that do need it won't have access to it. I have more confidence in Americans than that, continued Dr. Oz. It's an old malaria drug. We'll have enough of it and we ought to lift the ban. So this is a powerful voice, you guys, who is putting his name out there saying, hey, look, we see that there's efficacy in using this anti-malarial drug. Why are we banning people on the front lines from using this? So this is big news. Over the weekend, the FDA approved an emergency authorization to treat coronavirus patients with the drugs, which have been touted by President Trump as potential treatments. Last week, researchers in France issued a statement detailing how a combination of these medications, along with antibiotics like Z-Pak, we talked about that, could be a vital weapon in the battle against the coronavirus. The drugs have yet to be tested in a controlled clinical trial, but early data shows it to be a strong potential treatment to combat the novel virus. Guys, we're in the midst of a global crisis. You know, we can do randomized controlled clinical trials on things when people's lives aren't at stake. Think about it this way. Think about it like the doctors that are on the field in wartime. So as bombs are coming and it's just horrible all around them, do they have to wait for some clinical trial before they treat some patient on the field? No, they're going to treat them the best to their knowledge of things that they see that are working. And a lot of doctors are seeing that this treatment is working. So Dr. Oz is right. The time to do this is now. Many doctors are prescribing it until we get randomized clinical data, which I'm hoping we'll have over the next few months. We're not going to know for sure, Dr. Oz said, but there are already centers all over the world, France and China, researching this actively as we are in America. We probably have 100 reasonable candidates for solutions that could impact whether you block the virus before it gets in your nose, or block it from getting in your cells, in your nose or lungs, or block it from replicating in your cells, or just stop the bad side effects that it causes. Any of those places we can attack it, we will win. That's what I'm confident about. Our battle is more than short term. What we do over the next month, can we reach our peak over the next 2 weeks? And can, in 30 days from now, we look back and say, my goodness, we're actually coming down. Social distancing is working. Other tactics like masks come to the forefront. We're going to be looking for ways to live our lives, stay effectively distant from everyone. And then they give the statistics about people that have gotten this and then have died from this. So you see, there is this momentum. And in Nevada, the governor there had originally been one of those government officials who forbade chloroquine from being used with the coronavirus. Governor Steve Sisolak in Nevada has reversed his position. He's been convinced, looking at the people like Dr. Berkowitz that have been talking about this, and he said, hey, look, we now realize that this is actually helping patients get better. And so he did get called out when he was forbidding it, and of course, I'm not going to all this is just silly. So the governor's spokesperson said he was basing all of his decisions on medical experts. His endorsement of this Nevada State Board of Pharmacy's decision to place limits was based on what they knew and what other states were doing. See, this is the problem with leadership. A lot of times leaders, especially like governors, they just follow the lead of what other states do. They're not doing their own research. And if you're a real leader, you're going to do your research and see what's actually going on. And that's what he did. And he did finally reverse his position on that. Prescribing hydroxychloroquine without further proof of efficacy for treating COVID-19 or with the intent to stockpile the drug may create a shortage for those people that have ailments that they need the drug. That was their original, but now they have reversed it. So guys, good news happening. And then finally, we have successful high-dose vitamin C treatment of patients with serious and critical COVID-19. So yet another story talking about the role vitamin C in a high dose is playing. I'm not going to read this whole story, but it's basically out of China, where they have been using high-dose IV to treat patients with pancreatitis, sepsis, and surgical wound healing and other medical conditions. So when COVID-19 came out, they decided, let's give it a go. So they got a group of 50 cases of moderate to severe COVID-19. They started treating them with IV vitamin C. It was in the range of about 10,000 to 20,000 milligrams per day for 7 to 10 days. And then 10,000 for moderate cases, 20,000 for the more severe cases. All the patients who got the IV of vitamin C improved and nobody died. Compare that to the average of a 30-day hospital stay for COVID-19. These patients who received high-dose vitamin C had a hospital stay of just 3 to 5 days shorter than the overall patients. Pretty cool. One severe case in particular was deteriorating rapidly. He got 50,000 IV of vitamin C over a period of 4 hours, and there were no side effects from that, and he recovered. Big, you guys. And the problem with this is vitamin C is such kind of poo-pooed in the mainstream. Medical doctors, they rely on previous research, and in the context of looking at the studies, they try to always say, okay, what does this mean for this situation? And I think when COVID-19 hit, it was such a new thing that they were thinking in the old mentality of, well, vitamin C we know does this, so we can't give that, not realizing that It is a water-soluble vitamin, and if at the end of the day, if you consume too much of it or you have too much of it put in your body's going to excrete it. So there's literally no harm in having this, especially with patients that their risk of dying is extremely high. So we're seeing a lot of momentum now for these low-cost, proven treatments that patients with COVID-19 and the severest of symptoms are getting better, which should make you ask the question, why is this not the protocol everywhere, all across the nation right now, all across the world? Why aren't we seeing this? And Dr. Oz is right, that anti-malarial drug could be mass produced. You know, pharmaceutical companies can ramp up production pretty quick. And I say they stop making like every drug except for this drug. Well, you know what I'm saying. Not every drug. There's still drugs that people still need to take, but they don't need it nearly in the doses that they're prescribing it. And so why don't we kind of put all our efforts behind this? I heard a story about the MyPillow guy, the guy that makes the MyPillow, and he's like holding the pillow. He has totally converted his pillow company over into a mask making company. Did you guys hear about this? So he's using the same fabric that they make the pillows with, except he's making masks to give to the frontline people. So I thought that was really cool to hear. But what do you think about this? Like, we've got all these doctors seeing great improvement with COVID-19, the worst of the worst patients. They're getting better. And yet, this is not widespread. Hopefully, Dr. Oz's name gives it enough chutzpah that it will start to become more and more looked at. All right, let's see what you guys have to say. Going to come to Instagram first, then we'll come over to Facebook Live. Thank you guys for being here. Welcome in, welcome in. Thanks for being here on Jimmy Rants. JimmyRants.com is the website. Lulu says, someone knows about the vitamin C because I went to several stores and they're out of it. Yeah. It's getting out there. I think the mainstream is where we're talking about. They're not talking about it, but behind the scenes, people are still Googling and they're still seeing what's going on out there. So yeah, I'm not surprised that it's very difficult to find vitamin C in stores. Ilza says, well, they're not pushing this because it's not profitable. See, I think in a life or you're right, Ilza. But in a life or death situation like we're having right now, where people's grandmas and grandpas and sons and daughters, people in your life that matter are dying, profitability should be your last motivation. But you're right, people will still try to profit in the midst of this. Kat says, way to go, Dr. Oz. Hope is not lost. Yeah, I grew a newfound respect for Dr. Oz. I've not been a big fan of his over the years. He's dismissed low-carb keto diets pretty hard in the past with Gary Taubes and different people on his show. But dang it, if he's not right and if he's not doing a good thing using his name and celebrity to try to get this message out. Huge thank you for that protocol. Immediately shared it with all my colleagues overseas who are dealing with it right now. They're more open-minded. Yeah, it's so sad. Overseas and in foreign countries outside of the United States, they're embracing this. So I know Dr. Berkowitz told me that he got in touch with some government leaders and health leaders in the nation of Brazil, and the entire nation of Brazil, all the COVID-19 patients they're using this protocol with them now. So hopefully U.S. can get on board with this sooner than later. Beth says, how did they not get diarrhea with those high doses? So Beth, I asked that question of Dr. Berkowitz on Real Talk. You can listen in tomorrow, but in short, they space out the dosing so they don't just give it in one big bolus. They kind of space it out a little bit here and then 1.5 hours later, a little bit there. But you're right. In general, anybody that's ever overconsumed vitamin C knows it gets you poopy pants. Although I think when it's done intravenously, it's a different formulation than the pill that you would take and chew up or whatever. That one's the one that really gives you the poopy pants. So maybe intravenously something happens to prevent that. Kat says, uptake of vitamin C is much higher while fighting off the virus. Thus tolerance increases dramatically. And here's the other thing, Kat, that Dr. Berkowitz put on my radar screen. When you take a steroid with the vitamin C, the steroid makes the vitamin C work more efficiently and vice versa. the vitamin C makes the steroid work more efficiently. So there's this symbiosis, like that whole protocol, every single thing that's in that protocol is designed specifically to work together. And you take any one element out of that and it doesn't work as well. So keep that in mind if you're trying to pass this information along to a family member or some medical professional. Let them know the entire protocol is all intact for a reason. It's not just the anti-malarial, it's not just the steroid, it's not just the vitamin C, it's all of it put together. Ketosaurus Jax, vitamin C is fat soluble. Actually, no, it's water soluble, darling. I promise you. Healing scenery, drug companies want people to take drugs, not a vitamin. Yeah. And again, I have to ask, in the midst of a crisis, why are we worried about profitability? You shouldn't be. Keto Fit Mom says, my mom always used vitamin C when we got sick. Vitamin C and zinc are kind of magical. And of course, in the proper doses, yeah. Vitamin C will get excreted because it is water soluble. It will get excreted by the body if you consume too much of it. So, yeah, your mom was smart, Keto Fit Mom. Marty says, definitely picked up airborne and emergency packets for me and the kiddos. Yeah, there's certainly no harm in going ahead and getting your immune system as strong as it can be, which is why keeping glucose under control vis-a-vis a low carb, keto, carnivore, real food kind of diet is so critical right now. Tanya says, always thought vitamin C was not absorbed well in pill form, which is why it's being administered through intravenous. I don't know why I had trouble thinking of that word. Bonnie says, people who turn away from new protocols need to move away from pride because people are losing their lives. That's the thing. People are dug in their belief system, and it's a shame. Again, in a crisis situation, you don't have time for bias, because if your bias leads to a bunch of people dying needlessly, there's blood on your hands. And I hate to say it in that many words, but it's true. Synergenetic work. Yes, Kat, exactly. My mom was a nurse, so she always went the natural way. Well, God bless your mom, Keto Fit Mom. And you're probably the same way with your kids now. All right, let's come over here to Facebook, my personal Facebook page. Thank you, Living La Vida Low Carb Facebook. I'm going to remind you, I can't see what you're writing, but I do read your comments afterwards. So please share your thoughts about what we're sharing here today. Welcome in, guys. Thanks for being here. See what you got here. Why would you get in a hot tub with a fever? So before we came on the air, I talked about that I felt fever-ish. Why not? Why not? Why are you still overweight? Wow, I got some like ugly people on here today because I'm sexy and I know it. You're not going to get me down, dude. You can try, but let's just do one thing real quick. We're going to block your butt. Block party! Hadn't done that in forever. Haven't had to block somebody in forever. Joe, you got the first block in like a year and a half. So, wow. I appreciate your videos. Thank you, Rainey. Nancy says, Dr. Oz works out of New York City, so he's seeing the deaths up close and personal. I'm glad he's getting the message out for this new protocol to already approved drugs. Yes, so much good stuff. And I'm, again, very grateful that a big name like Dr. Oz would put his name to this. Like, that's big, you guys. We needed kind of a celebrity in the health realm to start talking about this, because the word needs to get out, and it hasn't been getting out. So that's what I wanted to share with you. I'm trying to keep you on the cutting edge. I'm trying not to talk too much about specifically the disease. My expertise is not in infectious diseases, but it is in people, and it is in trying to provide good information to people so that then you can be educated and pass it on to your loved ones and your medical professionals in your life. And that's all I'm literally trying to do here on Jimmy Rants, is provide good information, educate you, uplift you, I haven't done all COVID all the time, but when there is big news like I had to share here today, I will come here as soon as I can. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. As always, you can go follow me. I'm over at Instagram. Instagram Live is where we go at 11 a.m. Eastern Time, Monday through Friday, 2 p.m. Eastern Time on the weekend. Sometimes we do a bonus one at 5 p.m. Eastern Time during the week, so check it out, you guys, at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, please engage in my content. I try to do a lot of stories and things on my page that kind of complement what I do here on Jimmy Rants. You can also watch all the past videos at JimmyRants.com. Also on YouTube, type in a keyword Jimmy Rants, you'll find the show. So that's it for this time, you guys. Until next time, we'll see you then. And we're out.